Health Services, Inc. for comprehensive adult health and dentistry services. And we'll also ask the board this evening to approve the associated budget ordinance amendment. Mr. Jenkins.
Good evening, Chairman Adams, members of the Board of County Commissioners, County Manager, and team. On behalf of the Cumberland County Department of Public Health, I am pleased to announce a new partnership between the Health Department and Stedman Wade Health Services, Incorporated. The Health Department was awarded a community health grant in the amount of $148,000 from the Office of Rural Health, and that was to provide primary care services to the adult citizens of Cumberland County. This grant will fund the partnership between the Health Department and Stedman Wade Health Services, Inc. Stedman Wade Health Services will provide comprehensive adult primary care services and dentistry to both adults and children at the Health Department. Stedman Wade has already toured our facility. They've received HIPAA training, and they've received IT training on our computer system. After they got through with HIPAA training, that is. They will initially work 2.5 days and see anywhere from 24 to 32 patients per week. Their dental services will be provided during our extended hours, which are every second and fourth Tuesday of every month from 3 to 7 p.m. They're slated to see anywhere from 10 to 15 dental patients. Again, both adults and pediatrics. Even more exciting is the notion that once the grant ends, Stedman Wade Health Services plans to continue offering services at the Health Department at no cost to the Cumberland County government on a full-time basis beginning January 1st, 2018. They will then see anywhere from 24 to 32 patients per day. That equates to 120 to 160 patients per week. We continue to enjoy our partnership with Cumberland HealthNet. They continue to see patients every Monday, and we certainly anticipate Cumberland HealthNet adding an additional day in the near future. This additional day will equate to them being able to see 24 patients per week. So I just want to let the commissioners know that when it comes to seeing patients, I'm rather greedy. I want to have Cumberland HealthNet and Stedman Wade see our patients and our citizens. These partnerships speaks to the county manager's directive to explore public partnerships in an effort to serve our community. This is the first step in transforming our local healthcare system. Working with Cumberland HealthNet and Stedman Wade Health Services has the potential to assist in jail diversion, increase public health outreach, alleviate congested emergency rooms, and provide a viable alternative for healthcare. The need is great in our community, and we are set up to meet it. The partnership also provides a great benefit to the uninsured and underinsured citizens of Cumberland County by providing affordable healthcare services. We have been working with Sally and the PIO team. Letters to former patients and press releases are prepared, and they are ready to be sent out upon your approval of the contract and the budget revision. I'd like to just end by saying thank you for all that you do for Cumberland County, and I'm prepared to answer questions if there are any.
Commissioner Booth.
Yeah, that was one of my questions. I read the first paragraph says, once the grant ends, is there, you give an estimate that it's going to be gone by January?
Yes, sir.
Okay. And they're going to fund it themselves after that?
Yes, sir.
If I may, they're what we call FQHC, Federally Qualified Health Center. And then Mr. Jenkins and I had some discussions with the director of Stedman Wade. And it will take a couple of months. It'll probably take until January, but they would like to add our public health center as a satellite location under their FQHC.
That makes sense, 'cause
Yes, sir.
I didn't understand how we're only going to help them for a month or two, then they're going to do 124 patients after that.
We wanted to go ahead and utilize the grant so that we could begin providing services and then hopefully be ready January 1, and then they can draw down federal funding and continue to provide services, or actually expand beyond where they are today.
Yeah, I've just been real leery my whole life about grants and stuff like that, because you get people dependent on it. That becomes their eye doctor, their physician, and then all of a sudden the grant's gone and so is the services. So every time I hear running, it's not a perpetual thing. I always like to find out what's going to pick up the slack. So thank you.
And I will tell you that, Commissioner Booth, Dr. Sandra Carr Johnson, who we met, and those from the Stedman Wade Clinic, they are it's actually going to be a great partnership. They're going to do that at the health department. If you know, they're building the building right around the corner, which is actually still on the bus line on Merkson Road, a 10,000 square foot, which will transform that community. And the idea, hopefully, I think this can be, this board, when we ought to be excited, I think can be a model for somewhat the state of North Carolina in terms of the partnership we did, because in my estimation, if it comes the way we did when we met, would be that those folk at the hospital who go to the emergency room, and so the emergency room gets them stable and then gives them a sheet out the door and say, go see your primary care physician, and you don't have one, then you end up back in the emergency room. You come into the jail, within 48 hours, we give you the physical, you get stable and everything, and on the way out, we say, go see your primary care physician, you don't have one. The combination of Cumberland Health Net being able to be the one that funnel this into the health department, along with the Stedman Wade Clinic, is just going to be able to close that gap in terms of health care for some of our citizens who need it the most. And so I do want to thank the county manager when we called and had this, and Mr. Jenkins, and those down at the Stedman Wade Clinic, and Ms. Sandra Carr Johnson, who serves on our board of trustees out at Cape Fear Valley. That combination and that meeting, and out of that meeting is what ignited this right here. And Rod Ridgey, but I will tell you, it's probably one of the most exciting things that I've heard in this community to be able to do that. And if there are no other comments, because I'm not going to prolong this, if I can get a motion, Commissioner Fairclough.
Yeah, I just have a question. I think it looks like we're being asked to approve the budget amendment to receive the grant. Is there going to be anything else forthcoming on the actual partnership itself?
Go ahead.
Yes, sir. They will in turn present another contract at a later date to, basically be able to come in on a full-time basis.
Okay,
So
because
that-
I'm reading the word partnership here, and I don't know if you're talking generic partnership, like we partner with people and blah, 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 or if you are talking partnership in a legal sense. I don't think you are talking partnership in a legal sense, are you?
Oh yeah, it's definitely a generic
It's a
partnership.
collaboration.
Yes.
Okay.
And I think, Marshall, as it starts off, because we're using those grant funds, it's almost like a contract, and then in January is when it's actually, because they're going to take over with no cost to the county, it's more formalized in terms of that, if that's
Yes,
kind
sir.
of the way we do it. So if I can entertain a motion.
I move that we approve the budget ordinance amendment in the amount of $148,000 to recognize the grant award received.
I'll second the motion.
It's been moved in second. All those in favor?
Unanimous.
Thank you, board. I'll tell
y'all
you,
so
that was
much.
a great day for this county. Consideration agreement with Beaver Dam Fire Department for funding of staffing at Station 27. The county manager.
Yes, sir. Mr. Chairman and Commissioners, I'd like to ask our Assistant County Manager, Mr. Tracy Jackson, who works with the volunteer fire departments, to come forward and present this item.
Good evening, Mr. Chairman and Commissioners.
Good evening.
We bring before you tonight a request for consideration of a agreement between the county and Beaver Dam Fire Department. And I would like to, before I get started, recognize two individuals that we have here in the audience tonight from the fire department. The board president, Mr. Mike Ake, and the fire chief, Mr. Harold Shirley, and we thank them both for being here tonight. Some of you may be familiar with the history and how this has progressed over time. I will say that we've worked very closely with the fire department and the folks in the community to try to determine a best short-term solution to the problem they're having with the Turnbull Fire Station number 27, or Station 27, when it comes to staffing on a regular basis. This is one of our largest rural fire departments and largest land masses in terms of the geography, the space they have to actually cover and respond to. It has been very challenging for them to to have enough volunteers and paid staff in order to provide the coverage that they've sought to achieve and that the county has hoped for them to achieve. And so what has happened over time is that initially they were operating out of one main fire station. There was a recognized need to build a substation in the Turnbull area to help cover the other large portion of their district. Unfortunately, for whatever reason, in terms of staffing and recruiting volunteers, it's been difficult. This is not an unusual problem across the fire service in North Carolina, especially in rural fire districts. Our short-term solution has been to appropriate funds for this department for the remainder of the fiscal year to cover the staffing at the Turnbull substation. So we've developed in conjunction with the legal department an agreement for this purpose. And we've also included a budget amendment tonight. There was some discussion previously about where the funds would come from. Initially, in the budget, it had come from the general fund. Tonight, we're asking for a budget amendment in the amount of $75,000 to take that money from the special fire district instead of the general fund and to replace that into the general fund. So I will say that if you'll notice at the bottom of your memo, there are four bullets there. Those are the conditions that we discussed with the board president and the fire department so that they understood fully what we're looking for in terms of coverage out there and what we would need in return in terms of documentation and paperwork in order to receive reimbursement. And we've also discussed the need for hourly rates of pay and monthly schedules for that department. So that's what we have for you tonight. I don't know if you have any questions, but we'd be glad to try to answer whatever questions you may have for us.
Well, and I'll have a question, and I'll go to two commissioners. But I want to thank the staff and Mr. Beeman and those, and the people from Beaver Dam and from Turnbull. I went down there early in the year. It just shows you what communication and conversation can do. And it wasn't always pleasant, but we, by working together, you know, when I went down there and talked to you all down there, each one individual, that it's all about us providing services to this community. I want to thank you all for listening to that, hearing that, and coming back to be able to come to, it's a short-term solution, but I do want to thank you all for the hospitality you showed me down there, and for the staff to continue to work on that after we had that meeting going down there. So, Commissioner Keefe.
Thank you, Mr. Chair. I, like you, have been involved in this, and I have more of a comment than a question. To put things into perspective, and Chief Shirley and Mike, they have a challenge. They live in an area that has a landmass equivalent to the city of Fayetteville, and they are being challenged to provide, you know, fire service and emergency service. That means if someone gets sick out in that area, they're required to go out there. In an area the size of Fayetteville, I want to emphasize that. The idea of the substation was, we thought would help the situation, but the fact is, they have the largest landmass of a fire district and probably one of the lowest populations. So the funding is just not there. And this is a short-term solution, but there's a lot of action going on with the Public Safety Task Force. There's a lot of solutions that are coming up. But right now, services need to be provided to this area. And I know they've tried. We've had many conversations, and they've tried the best they can, but it's simply just difficult to do it with the funding that they had. So that being said, Mr. Chairman, I'd like to make a motion.
Well, I've got one more comment down here from Commissioner Booth, I think, if you don't.
Well, you can do it during discussion.
Commissioner
Go ahead,
Booth.
I'm kidding.
Commissioner
Go
Booth.
ahead.
No, I don't want to get in the way of making a motion.
I was on a roll, Mr.
He
Booth.
was on the roll.
And I thought if I got you on the roll, you could go.
He was on the roll.
I'll
But,
wait
you
till
know, that just
discussion.
keeps on rolling, so.
You messed up
Me?
the flow, man.
Yes, sir.
Okay, I didn't know. Okay.
I did, I'm sorry.
All right,
I apologize.
Yeah, on that it says, utilize the one-time supplement. How long is that projected to last?
So we're looking at June 30th. So it is up to $75,000, depending on the staffing and the rate of pay, hopefully to June 30th.
Okay,
That's
and
the intent.
the continue to seek permanent solutions, is there a timetable on that? Because this was something I heard about while I was campaigning.
Right.
So-
So, and Commissioner Keefe alluded to that. The Public Safety Task Force, this is one of those hot button issues for them in terms of the low wealth fire departments, how they provide staffing and response going forward. It is a challenge for any volunteer fire department, but especially for the rural low wealth departments.
Okay.
So we're looking for recommendations from them prior to starting budget discussions in the spring.
All right, so are they responsible then for the solution, or are they just going to make recommendations to somebody else?
Back to this board.
They'll make recommendations that we'll bring back to the Board of County
Okay.
Commissioners.
All right, and is there a timetable on that?
Right, so we discussed having that ready
So it's
for the
before
budget
this money ends?
for FY19.
So it's before this money ends?
Yes, sir.
Okay, all right. And are there any stats, and I'm just now trying to get into this, on fires during the day and fires during the night? I mean, has anyone looked to see where the proper time slot ought to be for these folks, since there's de
Yes, sir.
minimis out?
Yes, we've done that research. I don't have those numbers with me, but in general, I would tell you that it's tougher for them to field a response during the daytime when their volunteers are at work. And that's typically when most of the fire departments have their paid staff on.
And
But
Commissioner Booth, I'll tell you, and I think they will tell you, they get actually as many EMS calls now as they do the fire calls.
That was my next
Is
one
that
here.
not,
that's
they get
typical
more of
for the
those
fire
than,
service these
than the
days,
fire
yes.
calls?
All right, so the qualification sheet on this is going to have to be EMT certified,
Yes, sir.
both of them,
Yes, sir.
okay? And driver qualified on both of them.
Well, they have multiple standards they'll have to meet, and these are just the basic.
And isn't there somewhere that you're supposed to have two in order to even dispatch? I mean, I'm up there and you don't come on the shift till 4 hours from now. I get a call, do I just go by myself? Aren't you supposed to have two
That,
minimum?
part of the challenge here is all the different standards and training they have to adhere to. That comes with running the fire department. So at their main station, they'll have folks that are staffed there to respond. They'll also have folks at the substation. So I think what you're referring to is if you have a house fire, you have to have a certain number of people, a certain number of apparatus responding, and that typically is going to be the case. But then you also have mutual aid fire departments that respond from outside the district to help augment that.
Well, that's my dilemma. Since we acknowledge you have to have two and then we're only giving them one, I think then anything that goes astray, and I hope nothing does, but that should fall on us.
When you
It's
say-
like, you need 20 foot of board to get across a ravine, we give them 10 feet board.
There's two people.
There's two people.
There's two
Yeah,
people
but
in
they're
the
not
team.
there at the same time, are they?
Yes.
Yes,
Yes.
They are?
yes,
Yes.
yes.
Okay, I thought they were
Yeah.
floating a shift between the two of them.
No.
Okay,
No, sir.
good.
And
Thank you, that's
No,
good.
no problem.
And I will tell you, Commissioner Boots, they're not the only one with the issue. I think, who came from me, up in, Wade or Falcon, they're having issues with being able to get their people certified because of the number of hours that they've had. I've met with them. I think that, when you talked about EMS and driving the truck and doing all this, there are different certain hours. So that's why the Public Safety Task Force is there. But I've always, and we've had this conversation, this is actually going to be an issue for the state of North Carolina. It used to be that people would be out on the farm on the tractor and they would jump off and go to the fire department. Well, people don't necessarily work where they live anymore, and it makes it a lot more difficult. And so I think the whole issue surrounding volunteer fire departments is going to be one of, that has to be talked about.
Well, I think Mr. Keefe hit it on the head. I think that, and they've been here more than 2 years, I think, experience out there. They're getting EMS, EMT calls that aren't really even medical. I mean, by the time you get there, you find out it's, I can't get out of my bed and I dropped a cigarette on the floor. Could you get it for me? Or, I can't find my medication. Could you look for it for me? It's just too easy just to dial that. And I just want to make sure we're not shortchanging anybody.
Mr. Chairman, let me quickly clarify. So this little very brief contract incorporates a letter that Mr. Jackson sent Mr. Ake, I think, and I don't think that's, and it's supposed to be attached to this. that explained the term and the amount of money and stuff, so that it's fully covered, it just, not all of it.
And I will say, that's why I referenced the 4 bullets here, because what he's referring to, this is an excerpt from that letter. So those are the conditions here in the memo.
Commissioner Keith, with your motion.
I forgot.
Mr. Chairman,
Could I help you?
No, I got it.
If I-
Mr. Jackson has one
yes,
more thing.
I do need to add, for the record, the actual budget ordinance amendment number, which is B180599.
Say that one more time. He just picked his
Sure.
pen up so he can get that.
B180599.
Mr. Chair, I'd like a motion that we approve the funding of the Beaver Dam Station number 27 in accordance with the documentation and with the budget amendment of B180599 up to $75,000.
Second.
It's been moved in second. All those in favor?
Unanimous.
Thank you, gentlemen, so very much. We're glad that we're moving down that road where we talked about going. Thank you for your cooperation. Consideration of ordinance allowing the sale of alcohol beverages before noon on Sunday. Call on the county attorney, Mr. Morefield.
Yes, sir, Mr. Chairman, Commissioners, you considered this ordinance at the last meeting. It did not pass unanimously, so this is the second reading to expand the permitted sales of alcoholic beverages in the unincorporated areas of the county only to 10 o'clock a.m. on Sunday with an effective date to commence the Sunday after this is adopted.
Call on Commissioner Booth.
Mr. Chairman, I move that we consider an ordinance and approve an ordinance where we allow the sale of beer, wine, and mixed beverages beginning at 10 a.m. on Sundays in the county's unincorporated areas.
Second.
Any discussion? It's been moved in second. All those in favor?
Voting in favor of Faircloth, Commissioners Keefe, Adams, Council, Lancaster, and Booth.
All those opposed?
Commissioner Evans.
Thank you. Motion carries. Nominations to board and commissions. Fayetteville Cumberland County Parks and Recreation Advisory Commission, Commissioner Evans.
Thank you, Mr. Chair. I would like to, I move to nominate Ms. Pamela Story.
Commissioner Booth.
I'd like to nominate Lee Spruill.
Any other nominations? All righty. Go to number 9, appointment to boards and committees, the Joint Planning Board.
Mr. Chair, if you don't mind, we have 2 nominees for the Joint Planning Board. We had Diane Wheatley for reappointment and J. Carl Manning for reappointment. Being that there are equal number of vacancies and nominees, I move to appoint Diane Wheatley and J. Carl Manning to the Joint Planning Board.
Second.
It's been moved in second. Any questions? All those in favor?
Unanimous.
Okay. Thank you. And take a motion to go in closed session for economic development. Commissioner Faircloth.
Thank you, Mr. Chair. I move that we go in closed session for economic development matter pursuant to NC General Statute 143-318.11A4 and for an attorney-client matter pursuant to North Carolina General Statute 143-318.11A3.
Second.
It's been moved in second that we go into closed session. All those in favor?
Unanimous.
We'll go into closed session.
Mr. Chairman, did you want to recognize Miss Victoria Carter before we go into closed session?
I looked there, see, we will hold on a minute. See, I'm just over here getting ready to go. Victoria, if you come around. I'm sorry, Miss Carter. Thank you. That's why you got a county manager who keeps you in
Check.
in check. That's right, in check. She keeps me in check.
Because you're so late, we're gonna excuse all your homework.
All right, Ms. Carter, at the end, we thank you for coming, and if you tell us how you enjoyed it and any comments or questions that you may have.
I liked it a lot. It was very interesting, and I learned a lot about things that happened during this meeting.
Like the way the chair conducted that meeting, didn't you? All right,
Mr.
thank
Chairman,
you.
I did want to say, that her mother is Rebecca Rogers Carter, who works with the city of Fayetteville, so
Oh,
did
okay.
want to
That's why
point that out.
She can't be too complimentary.
She had to give it to, you come around so we can make sure.
One of us can get a picture with her.
One of them. Where to stay?
Thank you for joining us. Thank you.
Hey, I was the one that was out there at the, how many of them were at the glow party? Who was at the glow party? That's right, I was the only one at the glow party on 8 o'clock on Saturday night.
Hey, what was your time finishing?
Woo, no, that. How I walked in my front car.
There's a charity walk on it.
Thank you. We're gonna go in this closed session.
Thank you,
All
Charlie.
those in favor? That's unanimous. Okay.